Hey guys, welcome back. Today we have Dr. Thomas Doyle. He is a cardiologist at Vanderbilt University, and today we talked about heart issues, specifically with teens, and more specifically, we talked about what happens during a cardiac arrest, mostly during sporting events, and what you should do in those situations, and also how COVID affects the heart and if it has any long-term conditions. So watch to find out. Hey, Dr. Doyle, how are you?
I'm good, Austin. How are you today?
I'm good. Well, thank you for coming out on your busy schedule. We thought it'd be interesting to have someone talk about heart issues, and especially now with the COVID-19 pandemic and how it affects the heart. So, you ready to get
That's a
started?
great topic. So yeah, fire away.
All right. So, first off, can we start about talking about your early life? Where do you grow up, and where do you went to college, and how do you decide to be a physician and beyond that, subspecialize in cardiology?
Sure. I grew up in Philadelphia, outside Philadelphia, and went to college first year at Penn State, and then after that went to the University of Arizona, where it was the Wildcats. Enjoyed basketball and football there, and then from there got into medical school at the University of Arizona. Spent 4 years more there. Did my pediatric training at the University of Maryland in Baltimore, and then did my subspecialty training in pediatric cardiology at Yale University in New Haven, Connecticut. And after that, came down to Vanderbilt here, where I've been now for the past 28 years or so. So I've been able to see a lot of different parts of the country.
Yeah.
In terms of how I picked cardiology and medicine, I actually grew up wanting to be a herpetologist, or somebody who chased snakes and critters in creeks. I love catching snakes and turtles and frogs. And uh, my father convinced me that there was no career in that. Although in hindsight, I could have been the next guy on TV chasing the animals around. But when I looked at my passions, the things that I liked, I liked helping people. I really enjoyed science. And when you put those two together, it was kind of a natural tendency to lean towards some aspect of medicine, and picked medical school. Was lucky enough to get in. And then once in, I would walk down the halls of the hospital and say, who did I want to take care of? Did I want to take care of granddad and grandmom? Did I want to take care of mom and dad? Or did I want to take care of the children? And I just loved the children. I love their innocence. I love their strength and their courage, and got drawn to that. So picked pediatrics. And then once I was in pediatrics, the things that I really enjoyed were physiology and let me turn my thing down here. Physiology and how things work. I enjoyed physical exam and listening to people and being able to try and figure out what they have from just listening to them. I also liked long-term relationships. So I like to be able to see somebody, but watch them grow and develop, and also like the excitement of being able to do something kind of acutely to make somebody better. And when I put all those two together, and the people who inspired me, I ended up picking pediatric cardiology, and that's where I am today.
That's pretty cool. So, about your everyday office,
I'm sorry, my microphone went off here.
you're good. I can still hear you.
There you go. Well, I'm sorry, what did you ask?
So, in your everyday office, what are like the most common issues that you'll see within teens?
Sure. So we see a lot of, first off, we see all ages. So we'll see babies. Some of my partners see children even before they're born inside the mother, up really up towards adult level. But most common in your age group, the thing I'll see is something called a murmur. Murmurs are sounds generated by the heart. Everybody thinks about lub dub, but the heart will also often generate other sounds. And these are most commonly picked up on a pre-participation sports physical. So you're going to play soccer, tennis, or whatever, and you go to get screened, and they say, oh, by the way, we hear a murmur. Did anybody ever hear a murmur? And they said, no, nobody's ever mentioned that. And all of a sudden there's a lot of anxiety because people hear the term murmur and they start thinking, oh, I might have a hole in my heart or something wrong with my heart. The fact of the matter is the heart normally often generates other noises, and we call a lot of those murmurs, and most of those are innocent or functional in nature and represent nothing wrong with the heart. So if somebody's diagnosed with a murmur, or somebody's told they have a murmur, that doesn't mean there's anything wrong with their heart. It just means it's making an extra sound, and we get to meet the people and then try and decide if it's just a normal finding or if it is something else we need to know about. Other things we get to see, we'll see a lot of people who have chest pain. everybody gets chest pain at some point, and it's always worrisome because it's always right over your heart. So everybody's always gets concerned, rightfully so, when they have chest pain. And the good news is that in young adults or teenagers, the chances of chest pain being related to your heart is really, really small. And when we meet those people, we ask a lot of questions because the questions we ask are more important than actually the studies we do to help us decide if we're worried or not. Chest pain that occurs when you're sitting playing your video games or eating dinner or watching TV, we don't worry about those. Chest pain that gets my attention is the chest pain that occurs every time you go out and run. I go run, I start running hard, I get this dull aching chest pain, I have to stop. That's the kind of pain that gets a cardiologist's attention. Unfortunately, that's very rare. Most times it's other kinds of chest pain.
Yeah.
A couple other things we see, people passing out. And that always creates a lot of excitement, especially as it happens in school. You pass out, all of a sudden you're the center of attention.
Yeah.
And nobody wants to be the center of attention in high school. Fortunately, again, that's something that is often not a very serious problem, and we can usually work through those. But if somebody passed out when they were running or exercising, then I like to meet them.
Mm-hmm. So along with that, obviously, you see this a couple of times every year, but people during a sporting event, they have cardiac arrest. Can you walk through like what happens when that, what's going on with the heart when that happens, and are there any warning signs that you can get?
Yeah, so great question. Great question. Sometimes there are no warning signs, which is really why it can be so catastrophic, because even in hindsight, you didn't suspect anything. Sometimes people have complained prior to it of either having chest pain or dizzy spells or feeling their heart race and getting lightheaded when their heart's racing and they didn't think it should be racing. But that's not always the case. Sometimes it's just sudden and unexpected. The things that we worry about as a cardiologist that can cause this are some people can have abnormal thickening of their heart. The muscle gets abnormally thick, and that predisposes you to abnormal rhythms, which can lead to sudden death. Sometimes the arteries that supply the heart, what we call the coronary arteries, may be designed differently in such a way that when you exert yourself, your heart doesn't get enough blood flow, and that too can lead to an abnormal rhythm and poor function, and you could pass away from that. Rarer things would be abnormal heart rhythms that might predispose you to it. Fortunately, it's very rare, as you mentioned. Unfortunately, there's no gold standard way to pick everybody up ahead of time.
Mm-hmm. So say there's obviously, if you're at a professional sporting event, they have medical doctors there, but say we're just at like a high school game and that happens to someone, what should we do until the ambulance gets there?
That's a great question. So, and just asking the question is actually the place to start, because what you want to do is have a plan before it ever happens, and you want to practice it. I'll let my partner here leave. He's coming in. We'll let him get out of here. But the key is to have a plan. And I'm in Brentwood High School, for instance, is part of something called Project Adam, which is named after a young man who passed away during a sporting event. And his family pushed this forward, but it provides all high schools and schools all over the country with defibrillators.
Yeah.
And so it's one thing to have a defibrillator. It's another thing to know how to use a defibrillator. And once you've practiced it once, it's very easy to do. What you're going to be doing in a stressful situation. So to me, you're asking, what should we do? The first thing you should do is practice. So if I was the coach of a soccer team or a tennis team, I would say today we're going to spend 20 minutes and we're going to practice what to do if one of us collapsed during a game. Now, the important thing is to tell the coach that the most likely person to collapse during a soccer game is the coach, because they're older, they might not be in the best shape. You guys are young and healthy, so the most likely person to have an event during a game might be a parent in the stands, a grandparent in the stands, a coach. But they could go, we'll do the same thing for them. there's three things that need to happen. One person obviously needs to go and assess the person and see what's going on. The second person needs to call 911 and get them on the way. And the third person needs to go get the defibrillator. There was a great story in Tennessee this past year, where a school had just gotten their training with the Project Atom team and had gotten their defibrillator. And that weekend, after their training, one of their, I think it was a track star, was out training, practicing, and collapsed and had a cardiac arrest. And it was on video because the young man's father was videoing it. And the team did everything exactly right, including one person immediately running to get the defibrillator, not seeing what's going on, not focusing on all the excitement, but went and got the defibrillator. And they shocked this young man, and he survived. He did great, and it was really a blessing. But the key is what you said. What do we do? Well, we have to practice it at least once to know, and really you ought to practice it each year. Say, hey, coach, we should practice what to do if somebody collapses on the soccer field, on the basketball court. Because the hardest thing to do is to turn on the defibrillator. Nobody wants to take charge. So somebody's got to take charge, say, okay, I'm going to turn it on. And the defibrillator will walk you through it. It's going to say, put the pads on, push the button, analyzing, step back, and then you step back. And I guess I should point out also that the person who goes to assess the person should start CPR. If there's no pulse, they're not breathing, start CPR. It can be just chest compressions nowadays, if that's what you're comfortable with. You don't have to do mouth to mouth, but if there's somebody there that knows how to do it, great. But if not, good chest compressions can save a life while we wait for the ambulance to get there. Mm-hmm. A great question. Bring it back to your teams and tell them, hey, we need to practice this once this season.
I will, for sure. So let's move on to the COVID now. Can you talk about what COVID does to the heart? Like, what side effects does it have, if any, and causes any diseases? Or
this has been a big learning curve for everybody, not just nationally, but medically, to have this brand new novel virus come through the community and really take hold of everything. It has been shown and seen to cause inflammation of the heart. Fortunately, that's not terribly common, but common enough that we need to worry about it. And we don't know the exact number, particularly in your age group. The inflammation of the heart, what we call myocarditis, is often seen at the more at the extremes, younger age and the older individuals. In your age group, we see it, but not as much as at the other extremes. It can occur kind of during the infection itself, and you start to feel not so good. You're feeling short of breath. You can have some chest pain. Some people feel their heart racing, or it can occur a little bit later. You seem like you're getting better, and all of a sudden now you're starting to feel short of breath and having chest pain, and it rears its head. And because it's inflammation of your heart's a muscle, it can affect the way the heart works. So your heart function may diminish, which can be very serious, and often will end up having somebody end up in the hospital with it. The challenge is we don't know how frequently it really occurs, because many of the episodes are probably people who have no symptoms.
Yeah.
And they were very, they analyzed very carefully a bunch of athletes, collegiate athletes, and they found myocarditis in as many as 2 in 100. But most of those didn't even know they had it. And so the question is, how many people really got it, never knew it, and got over it? We don't know that number. Yeah. The segue to that is, and I know you're probably going to ask about it, is well, what about the inflammation after the vaccine? Mm-hmm. Which is a big concern as well. We know a lot more about that in terms of numbers, because it's gets people's attention. And the fortunate thing is that's incredibly rare. They estimate it's about 2 in 100,000 people. Mm-hmm. That said, there's a particular group that gets it more than others, and that's your age group, young men, in the late teens, 20s up to 30. That group, for whatever reason, seem to have a higher predilection to getting this. And so the question that I've had to deal with or try and figure out is, if I'm a young man your age and I have a risk of getting myocarditis from the vaccine, am I better off not getting the vaccine and taking the chance of getting COVID because I might do well with COVID? And the answer, after really looking at this as best I can, is really no, you should get the vaccine, because as best we can tell, the risk of getting myocarditis from COVID itself is much, much higher than from the vaccine.
Yeah.
And it's much worse. It's longer, it's more intense. In many people, it leaves permanent injury. Whereas what we're seeing in the individuals who get it after the vaccine is it's a very short course. They get better, their hearts get better. And there's very few, although not zero, but there's very few have long-term problems from it or have died from it.
Yeah.
So we still recommend, even in your age group, the vaccine's the best approach.
So what if like you got COVID before you got the vaccine? Would the heart damage, would it still be permanent, or?
Hopefully not. And if there was any question, you could end up coming and see me, one of my partners, and we can check you out. The vast majority of people will get better. And as I said, there's probably a whole lot of people that might have had some form of inflammation of the heart and didn't even know about it. One of the challenges comes in once you've had it. How do we go back to sports? And there's some recommendations, and the American Heart Association and others have come up with recommendations for that. But if you had a mild case of COVID and no evidence of myocarditis, we say, take 2 weeks off and then go back to sports. If you started going back to sports and then you develop some symptoms like chest pain or shortness of breath, we would say, well, now you probably ought to see somebody. You can start with your pediatrician, or you might come right to the cardiologist. But those are the people we're interested in. You felt fine, started exercising, now all of a sudden you're getting worse. Or the person who's really sick during the infection and not getting better and having symptoms. Yeah. Once we've diagnosed you with myocarditis, and that often requires some blood work, EKG, an echo, maybe an MRI, that's a big deal, because it can be permanent inflammation of the heart. And the concern is that exercise during the inflammatory period can worsen that injury. And so when we meet somebody with myocarditis from COVID, we tell them, or myocarditis from any kind of virus, you need to be taking it easy, no exercise for 3 to 6 months. And that's devastating for many young people who have sports as a part of their who they are. Yeah. Often devastating for families who have been looking forward to watching their kids, play on the girls' volleyball team or whatever. And now all of a sudden there's some cardiologist telling them you can't do anything for 3 to 6 months. Yeah. And then after that, we reassess people, often repeat MRIs, and hopefully by then things are better and you can go back to sports. But even at that point, there's more evaluation that goes on. We will typically recommend a stress test and some other monitors. So it's a big to-do. And the best thing to do is try and avoid it in the first place.
Yeah. So you might not know this question because the pandemic might not have been around long enough yet, but is there a possibility, say, I had COVID like 2 months ago, and then in like 5 years down the road, I'll have heart issues?
That's a great question. And I don't know the answer to that, and nobody knows the answer to that. And that's a concern, though. It's a big concern, not just for heart, but all these other things. People lose their sense of taste and smell. Is that going to somehow impact you down the road? Nobody knows. And so we're kind of on the front end of this viral wave. And I think we will continue to learn things about it as we go down the road. If it's like other forms of myocarditis, where if your heart completely returns to normal, then your risk of something bad happening, abnormal heart rhythm, something like that, it's not zero, but it's low. If it's like other viruses where some people will have their heart impacted and it doesn't get back to normal, then that person is at risk for other things happening down the road. And then if it impacts your heart so bad that you can't even survive with that heart and you might need a transplant, then clearly that's going to impact you down the road. So it's a great question, but nobody yet knows the answer to that.
Yeah, it's hard to tell.
Yeah.
So, last little question here. Are there any specific blood types that are more prompt to any specific heart diseases?
It's a good question. I do not know of any specific cardiac lesions that the blood, and there may be, and somebody will call in and say, hey, why didn't you mention this or this?
Yeah.
But I don't know of any. And so when I'm seeing somebody, I'm not usually worried about what particular blood type they have. What I do worry about related to the blood, though, is what's your family history for heart disease? How early were people in your family having heart attacks? And if it was at an early age, do people know their cholesterol? And particularly in your age group, there's data now that says we really ought to know our cholesterol early in our life. And even as teenagers, if we have a genetic predisposition and we have high, lipids or triglycerides, we ought to start treating those early to prevent the sequelae down the road of coronary artery disease. So that would be something along the bloodline that I'd be more interested in than necessarily what your blood type was.
Well, that's all I have for you today. Once again, thank you so much for coming out and doing this. I know you have a really busy schedule, so
No. Thank you for doing this, Austin. This is great, and I hope it was helpful. And you tell all the coaches at your team at the high school, once a year, we need to practice what happens if somebody collapses.
Yep.
You don't ever want it to happen, but boy, if you've practiced it once or twice, it could be life-saving for you or your friend or somebody, close to you, or your coach. Remind them that the coach might be the first to go down. So
I'll definitely let them know.
okay. All right. Thanks so much.
You're welcome.